Hi, my name is Dr. Nikita Wilkes. I'm a licensed and board-certified obstetrician and gynecologist in Jacksonville, Florida. I received my training and residency at Shands, Jacksonville, and I also received my medical school degree at Florida State College of Medicine. Today I'd like to discuss postpartum depression. It's a very common problem after delivery, but not often discussed. Postpartum depression is not often discussed between women because of the fear of judgment or the fear of mental illness in the community. Yes, women that are at risk for postpartum depression include women who've had a previous history of depression, a strong family history of depression, those who've had some postpartum related problems, complications, either bleeding or longer hospital stay, those patients who have children that may have to stay in the hospital for a longer period of time or have medical care needs immediately after delivery. Postpartum depression sometimes can get confused with two different things, so I'd like to discuss both. Postpartum blues is actually very common after delivery. The first couple weeks from delivery, most patients can feel some sadness, sometimes a little bit of grief, tiredness, fatigue, and every now and then may have some tearful moments in relation to dealing with a newborn. But postpartum depression is usually a more severe diagnosis where patients are extremely sad and unable to explain it, overwhelmed, sometimes having anxious moments, tearful for no reason at multiple points of the day, difficulty with dealing with their partner, their spouse, the child that they're taking care of, or other children that they had previously. Patients may sometimes feel as if they are not able to take care of their little one, and in severe cases may feel like they want to harm themselves or the people around them. In the society now, postpartum depression is actually very common. 10 to 20% of women will have some form of postpartum depression. That's equivalent to 1 in 8 women could have this particular problem. Postpartum psychosis, which is actually extremely severe, where patients also have hallucinations and may end up doing something harmful to their family members, which sometimes, unfortunately, we do see on the news. That happens in about 1% of the population. So, in either case, it's important enough to be discussed. Patients, I think the main thing with postpartum depression, women really need to recognize it. Being able to openly talk with their physician about it is the first way of getting help or seeking treatment. Some patients decide not to take medication, so if they do not want to take medication, they usually will see a counselor or try support groups, and that sometimes can alleviate some of their symptoms and fears. Patients in more severe cases may require antidepressants. So after delivery, patients tend to have a decline in their estrogen and progesterone, which sometimes can cause some changes in their moods and the way that they do their day-to-day activities. Similar to how patients have a decline in hormone right before their menstruation, which people equate that to premenstrual syndrome. So for patients that are having those difficult chemical changes, the antidepressant, the goal of that medication is to help balance that out. In some cases, postpartum depression may be able to be alleviated some of the symptoms. In patients who had previous postpartum depression, they can already start on medications prior to delivery. Patients can also have counseling or sometimes have received counseling prior to delivery to deal with their previous symptoms that they know of. Recognizing patients who are at risk, so you can talk to them early, or some ways to help prevent it, but in some cases it just happens and we can't prevent it in all patients. If there's concern, women should really contact their physician. It's important for them to feel comfortable enough to talk with them about this particular problem, even if it's just, in the case of postpartum blues. The physician will at least evaluate the patient, see the necessary treatments, provided, and then also discuss with the patients, if they don't need treatment, how to reassure them and encourage them in their postpartum care. So in our practice, we do offer screening tools for not only our postpartum patients, but as well as our annual physical exam patients. We offer a depression screening tool, and it gives the opportunity for us to see how the patients are feeling without them actually directly talking to us. And in some people, that gives them a segue into discussing things that they didn't previously want to discuss as they come into the office. Other things we do is we always talk with our postpartum patients, and it's a part of their routine postpartum visit to discuss any signs of depression, stress, life stressors, problems at home, things that we can do to help alleviate those problems. And then we discuss options as far as treatment, including counseling as well as medical treatment. What I want women to really understand is that postpartum depression happens to 1 in 8 women, so it is very common. It's the same as breast cancer, which is also 1 in 8. Women need to understand that this is a true medical condition. It is okay to be treated, and it's okay to discuss it with the population. Discuss it with their physician. As well as if they don't feel initially comfortable with their physician, discuss with a close family member so they can help get them to the right person.